Thank you very much, Minister Pando. Colleagues, we decided to come with all these matters for updates so that we are all on the same page. As you will be aware, many of the matters that colleagues spoke to are matters that emanate from the address of our president last night. So we are then giving update on implementation on these matters that our president has raised. But all of these issues that we are speaking to, they also speak to one thing. How do we continue to save lives of our people from this deadly virus called coronavirus? That's what we are speaking to, so that we don't lose the essence of what we are talking about. The lockdown and all the measures we've taken, including at the aviation space level, measures we're taking to give relief to our workers, measures we are taking to give relief to small and medium enterprises. All these are within the ambit of all of us, protecting our country, protecting our people against this deadly virus. We have seen what damage it has done to other countries. Spain, USA, Germany, France, Italy. We have seen what damage and how many people that this virus has killed throughout the world. Numbers are standing at 38,000 now, deaths as we speak internationally. Having said that, colleagues, we are just bringing the context so that as we deal with all these issues, we must not lose what is this fight that we are waging and against this invisible enemy. Colleagues, it's now your time to ask your questions, and we would like to thank you again because you are a very good partner and ally in our fight against this deadly virus. Colleague. That's it. Then we will also take colleagues who will also call us through the call center. Let's start with SABC.
Good afternoon, everyone. I'm Criselda Lewis from SABC Television News. Minister Nxesi, I'll start with you. Are you able to give us an indication how many complaints you've received just on you being on the podium speaking about employers asking employees to take leave? Our timelines are flooded with such instances where many South Africans seem to be complaining about being forced to take leave or no work without pay. That there's a lot of that happening. Do you have any idea how many complaints you're investigating at this time, also with regard to the fake permits that you have? Minister Mbalula, you seem to be very optimistic about the relations that you've, or the talks you've had with the taxi industry. You would know that there was a protest by taxi drivers in Njoli, in the Eastern Cape, in PE today. This is post your discussion last night. Are you satisfied that perhaps this might be able to yield results? And finally, the MSC Orchestra. I understand that there are 3,000 South Africans, or rather individuals that were on the MSC Orchestra, that are being sought at the moment after a case of COVID-19 was confirmed there. I recall that case, and many of those individuals were just screened and let go. Now there is this particular instance that might cause a certain crisis. Are you aware of that? How are you dealing with it? Thank you.
Thank you very much. Next colleague.
Hi, Bonga Dlulane, EWN. I'll start with you also, Minister Nxesi. You said something very interesting earlier on about companies who are have fraudulent essential service permits. I just want to get a clear indication of where's that scale of that investigation and how many permits are we talking about here? We're talking big companies, small companies. Just give us a clear indication exactly what kind of sanctions also. Will they be arrested on the spot? Fines by police? How much? To what extent? Minister of Small Business, Bonga here again. In terms of what spaza shops need to do exactly on the 2nd of April, can you just give us a short description? What will they need? Will they need to supply everything, ID, information when they are, so that you can authenticate that these people really do own these spaza shops, and also how many people they employ? For you, Minister Pando, maybe also Minister of Transport, who also want to come in here, when you're talking about people who are in distress in other countries or stranded, and you're looking at how if they can't use their own money but they want to come back, are we talking another who situation? Are you looking at maybe you might have another repatriation example? And also, where are those talks or discussions, or if you are having them at all? Thank you very much.
Next, colleagues.
Lizzie Gatano, News 24. Minister Pando, just one small question from me. In terms of the 1471 South Africans that have requested to be repatriated, how many are coming from high-risk countries?
Okay, next.
Kyle Cowan from News 24. My question is also for Minister Pando. Minister, ventilators are going to be a very crucial resource in our coming fight against COVID-19. We have strong ties with countries that can produce these ventilators at a very large scale, especially China and India. Are we in discussions with these countries to help us? China has helped the US. Are they at the table yet to maybe help us with some ventilators? And then News 24 reported over the weekend, the representative of a major manufacturer of ventilators in Germany said that Africa is in the back of the line for these ventilators right now. In your discussions with other countries, Minister, with representatives from other countries, is this your sense? Is South Africa going to be helped by these countries, especially those whom we have strong trade relationships with? Thank you.
Thank you very much, sir. Next.
My name is Nazir Nur Mohammed, Globe TV. To the Minister of Transport, you spoke about border control. We all agree that this is a serious matter, that we should do everything to kill this virus, to stop this virus growing. Would you consider restrictions between provinces, movement between provinces, especially passenger vehicles? To the Minister of Small Business, there's confusion exactly as to what time small business should close, the spaza shops. I know of an incident where someone got arrested for trading at 6 o'clock in the evening. What are the trading times allowed for supermarkets and small businesses?
The back.
Thank you so much. Franz Luaramachata from Progressive Independent News Agency. Minister Nxesi, there's a segment of the job-seeking professionals, and some of which were retrenched in the recent past, and as a result, they are no longer on the UIF, and they are unemployed. So, have your department actually considered this segment of the unemployed professionals?
Yes, sir.
Good morning, good afternoon. My question goes to Minister of Small Business. Minister, can you clarify, please, about the pledges announced by the 1 billion pledges announced by the President from the Rupert family and Oppenheimer? Are they loans or donations? Thank you very much.
To our colleagues who are manning the call center, do we have any questions?
Minister, we've got 3 callers. We've got Vuyo Mboko on the line, followed by Show from NHK TV. The last caller will be Jiden from Carte Blanche. Vuyo is the first one.
Vuyo, take the platform.
Okay, Vuyo Mboko from ENCA. Thank you. To the Minister of Labour, what reasons or excuses are companies giving for refusing to enter into arrangements with your department? And then to the Minister of Transport, You mentioned last week that you were in conversation with the Germans about the repatriation of their nationals. Is it true that they are going to be flown back by African Airways? And if so, who will be footing the bill? And lastly, to the Minister of International Relations, are you able to very quickly take us through some of the latest offers of help from some of the countries that have made them?
The next colleague.
NHK TV show.
Speaking. Yes, hello.
Go ahead, sir, we are listening.
Yes, my name is Show Pepu from NHK, the public broadcaster. My question is about racial stereotyping and racial profiling. I guess this question is addressed to Minister Mthembu and Madam Minister. It's quite often that when I'm covering events in South Africa, I am a Japanese national, and I'm screened at by many people in the public as Corona, China, China. What do you think is the best way, you as a government official, to fight against this trend, limited it might be, but some people, to associate Asian nationals with a certain disease, but in this case Chinese, to the coronavirus? Secondly, related to that, as I said, I am Japanese, I'm not Chinese, so even if the people shout at me ni hao in Chinese, I don't understand what they're saying. But some people say that it's my fault because I dislike them. I have the same physical appearance, I have the same skin color. And how in this country that has a proud fight against apartheid, some people still judge people based on the color of the skin. What is the message that we should give out to this trend? Thank you.
Thank you very much, sir. The last caller.
Gideon from Carte Blanche.
Continue, sir.
Go for it, Gideon.
Hi there. Can you hear me?
We can hear you loud and clear.
Thank you, Minister. So my question is with regard to South Africa's passengers who are on the cruise liner the Costa de Minosa. They spent 9 days stranded on the Mediterranean and were finally allowed to travel to Rome. And they are now in quarantine in a hotel in Rome, and they're in quarantine till the 6th of April. How would they go about finding a way home?
Thank you very much. I will now allow my colleagues to answer, starting with Minister Mbalula.
Thank you very much, Griselda Lewis. We met with the taxi industry yesterday. There were issues that were raised in terms of times that were in the regulations, 5 to 9, and also 4 o'clock to afternoon. But also there were issues that were raised in terms of the number of passengers per minibus taxi. Those were the issues that were raised, and we engaged with the taxi industry with a view of resolving all of those concerns. Of course, the taxi industry raised issues related to subsidy of the taxi industry. Now, I want to address this issue. The Department of Transport, when we caught up with this virus, Corona, is engaged in the process of looking at the business of taxi industry in the Republic. We were in the process, which we are still in, of engaging with the taxi industry in a huge platform that will lead us to what we call a taxi indaba. But this taxi indaba is not like all the indabas you have heard of. It's about intervening and on the question of the taxi industry in terms of its makeup and business, and at the same time, how can government intervene in terms of subsidy for the taxi industry. These issues are going to cabinet, and these issues will be discussed and are discussed between government and the taxi industry. Among other issues that we are discussing is how to regulate the taxi industry. Minister Nxesi, when he talk about UIF and workers and all of that, you will realize that with regard to the taxi industry, a taxi driver will not be covered with regard to that because the industry is not regulated. They are just driving taxis, getting paid weekly, and then they are paying, their payment and salaries and all of that are not regulated. They are not covered in terms of tax. I know somebody who owns a taxi will say that before I buy a taxi, I'm regulated in the sense that the banks ask for my tax clearance. But that is not regulating the industry in the form of business. And regulating the industry will mean that the industry as a whole is recognized. All issues that are related to what is required for a business that is regulated will be addressed. But over and above that, we do understand why there are those challenges, and this is what we're looking at. And we're looking at the subsidy of the taxi industry. So when we got caught up with the virus and dealing with it at the present moment, you must be cognizant of the fact that the issue of taxi subsidy and its discussion is on the agenda of this government. Now, we cannot, because of the virus, take decisions that will not be sustainable. And then take decisions on our toes about subsidy, which we have not looked at, and at the same time process properly through government. And I'm just raising that particular point to say that one of the issues that have been raised in our discussions are those, including how do we compensate the taxi industry for the loss of money and all of that. We have introduced some with the Minister of Small Businesses in terms of the sphere that she's in charge of SIFA, to say that taxi industry must be covered also in relation to those who are supposed to pay their installments, that at least they be given a reprieve for a period of time, and that include big banks as well. The question before us of subsidy is a matter that is before government and that we're attending to. So in our discussions, we engaged with Santaco, and we engaged with Santaco, and Santaco requested to go back to its constituency. And then that is last night, led by its president, Mr. Tai Bosch. And before I came to this meeting, it looks like things were different. And they raised all issues of time, and now government can come to the party. Now, from the National Command Center, we have reflected on this matter, and we've got the new directives. So those directives will be gazetted, and we'll announce them tomorrow. And we intend to do so having engaged with the taxi industry. So I will not go to town on those today, but all the issues the industry have raised, we have taken into consideration. We also met with NTA, and the NTA also reflected and raised their issues. And then we agreed on what we agreed on, and we will be able to speak on those matters tomorrow with the media with regard to the question that NTA will have raised with us. However, we are concerned that there are, calls for the shutdown after the meeting which the president of Santaco related to me, that when meeting with the structures, they agreed that there must be a shutdown. But I said, okay, and then he came back to me also before I arrived here and briefed me that he had further engaged and that the issue of the shutdown is no longer on the agenda. So our team, my DG, and together with Santaco, we've been talking to them, as we would have been doing between myself, Santako, and his leadership from last night. So we are engaging on all these issues. And Griselda, I can tell you that I'm quite not only optimistic, but after engaging with the taxi industry, I think there is an understanding that this issue is beyond us. Meaning, we did not, plan to be where we are in terms of the coronavirus. It's beyond us in the sense that the concerns the taxi industry is raising are matters that are on our agenda, that as government we're attending to. We need to attend to the emergency because coronavirus is an emergency. Nobody's making money. We're all running things at a loss. And where we can, we need to intervene to alleviate the situation. So that's what we're doing in talking to the taxi industry in our country. And the majority of them will understand that we are in a precarious situation, that government can't take a decision and within its coffers and say that we've got this money that we can invest in the taxi industry and to address the loss. We don't have that money. And the Treasury itself had to look all over to see where we can get money, to get masks, to get gloves, to get sanitizers, to deal with crooks who think that is a holiday for them to make money and exploit our people. And that is across. So strict regulations had to be introduced in relation to that, to deal with the coronavirus, which we did not plan for. It's unlike when you deal with ESCOM, because you envisage where we should be and so on, but coronavirus, nobody planned for it. Well over. So our plans in relation to the subsidy of the taxi industry in the long term are not suspended, but they are delayed in the sense that our talks and engagement and getting government to move faster on this matter is being affected in terms of operation. You must understand that government, as in government, through cabinet, is not suspended. There is cabinet in this country that must still process issues, but there is a special dispensation of the command council led by the president to focus on the coronavirus. And we are processing all these issues in the context of the disaster management regulations that we are responsible for. So the challenges that we've got with the taxi industry and the concerns in the context of the disaster, we are dealing with them. But when I conclude on that point, it must be understood that we don't intend to transport anybody. The transportation that is provided is for emergency, meaning in the morning is for health workers. If for somebody who's working at the supermarket to be transported in the morning and in the afternoon. But public transport, like all other transport, is prohibited. And we want to repeat once more. We don't expect citizens to travel long distances to get groceries and all of that. We, however, acknowledge that most of our people got paid just last week. And that is why we began to see huge movement on the ground, on the queues and all of that. But transport that is there is limited, colleagues. It is for essential workers. We don't expect people to commute on a daily basis. So there will be a loss for the taxi industry in this particular regard. So those are matters that we are dealing with. As we issue new directives, we are listening to them and addressing their concerns. And it is disturbing to get calls like strike, like as if we're not talking. There's no need for a strike. There is no need for a shutdown because we're talking, because this is a crisis. This is a human disaster crisis that is facing a taxi owner, a taxi driver, a commuter, a rich person, a poor person is faced with this disaster. So if you say shut down, close down, this and that, it doesn't work for us as a nation. So we need to come closer to each other and address the concerns that we need to address in terms of the taxi industry. When it comes to MSC and Griselda and the people that were screened and all of that, It's not correct. You must understand we pass regulations, and when you get to the port of entry and give yourself time, the people you meet there is borderline. It is Home Affairs. And then Home Affairs, after it go through people who come into the country, what happens, it surrender people to Port Health. And what Port Health does, which is Minister Mkhize's people, in all ports of entry, is to screen people and all of that. But if you've got a vessel and then people have been screened and all of that, in terms of our regulations, which we have even tightened more, you are not allowed to disembark. You are basically confined where you are and evacuated. So that's why you have had evacuations and evacuations of citizens from foreign countries, Germany, United States, and some of them are still at sea. And they will be evacuated, and their countries send aeroplanes to come and fetch them from South Africa and to the countries where they actually come from. And some of them, after we have assisted them to refuel and all of that, they then continue with their journey to where they are going. So that is what has affected South Africans in Italy today, who were on a journey and went to France, and after that they could not enter France because the regulations said no. And now they are trapped and stranded in Italy. So it's not only South Africans, it is well over that regulations were passed and lockdowns were implemented and so on. It affected citizens, not only our citizens, but citizens across the world. So we've got to work together, but not compromise health as directed by Minister Mkhize. So when you get to a port of entry, you are supposed to be screened and you are supposed to be quarantined. And that is what actually happened. Now, there is an allegation that there are people who came from this MSC. Now, you must understand that our laws are not retrospective. When this MSC left to wherever they were going, which majority were South Africans, and there were no citizens as prescribed by the law then who came from risk countries. Nobody. And nobody on board was actually detected to be suffering from coronavirus. If that happens, the whole ship will have been dealt with in terms of the protocols that we've got. And they followed all the protocols upon returning, having come into South Africa and so on, and they were attended to, and together with the Department of Health, and they were properly processed. So the people who can speak about people who come from this ship and who've got coronavirus is Minister Mkhize, right? As the Minister of Transport, all protocols were followed. And this ship, among others, it is one of the ships who threatened us with litigation through a company called Bowman's Attorneys, which we had to attend to in relation to our regulations. So on our part as transport, all regulations were followed, and on the part of health, all protocols were followed, and the rumor that the people in that ship suffered from coronavirus, we all got it on social media. Because somebody who claimed to be working there then said that certain things did not happen and all of that, which is not true. Now, SAMSA, our agency that is operating there, issued a statement to that effect, which you can go back to that statement and clarify. To this day, we are still dealing with the matter to ensure that all the allegations that are made are actually being followed. But it has not been forthcoming that there was somebody on board of MSC Orchestra who actually suffered from this. Now, coupled with that, which we need to clarify, there is a ship called Queen Mary, which is on dock as we speak, and there is a ship called Queen Elizabeth. Queen Elizabeth has got 6 seafarers, which are South Africans. They've been checked. Minister Mkhize is on site as we speak, and as a Minister of Transport, we had to give clearance in relation to the code of ISPS, which is what we're supposed to do, and then allow those South Africans to disembark, and they've been checked in terms of the protocols of health, and they will be quarantined. Do you understand? They will be quarantined, those 6 people who are off Queen Elizabeth. Queen Mary is still at sea and on dock because it will have to be refueled and go to Italy in terms of its journey. Now, there are allegations that there are people on board of that ship who are not South African, who are suffering from, who have been detected, or it is suspected that they could have contracted the coronavirus. All of that is taken care of, and nobody from Queen Mary is disembarking to come to South Africa. All of them, they are passing through our port, and we're doing what we're supposed to do in terms of our protocols, and nobody is disembarking. So please understand the difference between Queen Mary and Queen Elizabeth. And these 6 South Africans on Queen Elizabeth, when I spoke in the press conference last time, I clarified that they were not allowed to disembark up until the necessary protocols are followed. It is only today that they will actually disembark. I will not speak about stranded people and so on. Minister of DERCO will speak about that. Restrictions province to province. The regulations do not allow you to move from Gauteng and go to Northwest as we speak. Once you get into your small car or a big car and you think that you can drive through and go to Free State, you'll meet law enforcement on the road and you'll be returned. They've got to be permit for that. Now, I know there's been a concern all over the place about if my family or somebody in my family passed away, what happens in terms of travel. That has been catered for. People must produce permit because the regulations, you'll have to provide permit in terms of your travel. But there is one problem, because somebody went to court in Mpumalanga and tried to challenge the regulations because their father or family passed away and went to Mpumalanga High Court because they wanted to travel somewhere in the Eastern Cape, if I'm not mistaken. And the High Court dismissed that case in favor of government to say that you don't have to travel. Now it is law that you can't travel to any other province and so on. However, permit will be sought and can be provided if you can produce that you are traveling to your family's funeral and all of that, that you can actually be allowed to have free passage to go, as long as you can provide the details in relation to that. With regard to Germans, is it true that they'll be flown by SAA? Yes, they will be flown by SAA cost, German government, not SAA. Well, what SAA does is to repatriate those citizens from here and fly them to Germany. We don't expect SAA to come back with a flight full of Germans to South Africa. If they do that, they will be in contravention of the regulations. They must come back with an airline empty, or if ever they come back with anyone, it should be a South African, like we have stipulated. If they go to Germany and there are South Africans who want to come back, they are allowed to come back on that airline. So those are the only people we cater for. And South Africans, when they arrive here, they will be quarantined, mandatory, quarantined. That is strict. There is no free movement all over the skies. So that has been prohibited, and it is prohibited. So if you decide as a German government to pay SAA to repatriate your citizens, that will be done. Okay? Just like all other countries who will be coming to South Africa to repatriate their citizens to the UK, that it will be done. If there are South Africans in Maldives who are trapped there and who have been contacted, we know that they've got the capacity to come back home, and then and so on, they will be allowed to come back home. We've got the new directives, we have signed them last night, they will be allowed. South Africans in Qatar who want to come back home, Qatar Airways want to bring them home, that will be allowed. But we will not allow anyone who comes from anywhere else in the world to use that space to come to South Africa. They will be prohibited. like it has happened with Air China and all other airlines. So with the lockdown, no airlines are flying all over. They've been grounded, and they've complied with our regulations. That is that, and then carte blanche, South Africans in Rome, I've explained to you. We will deal with that in the context of these new directives, because that ship was ready to get them an airline to bring them to South Africa. We'll process them according to the new directives, but also in terms of the health protocol. So you're not just going to land at OR Tambo, you are South Africans, you go straight home. It's not possible. You will be quarantined for a period of time to be checked, and then afterwards, all the protocols will be followed. So the directives stand, and with the proviso that we've got to cater for South Africans who are stranded, but also we've got to respond to evacuating citizens from other countries. So siyabadedela bagoduke. Enkosi.
Minister Ntshavheni, I know that you have a teleconference soon. Come and respond to your questions, ma'am. Is this your phone box?
When the application is going to be available, we are hoping that we'll announce that the applications are available on the site and the permit from their municipality to trade.
Okay.
Those who do not have permit from their municipality, they must go to the municipality to apply for permits to trade.
It was off.
Thank you. It doesn't realize. We're saying, maybe it's good that it happened that way. We've got two processes. For South African spaza shops who want to access the support scheme, they must have identification, South African valid identification, and they must also have permits from their municipalities to trade. If they don't have permits, they must go and apply for permits in their municipalities, as I've indicated earlier. Then the related issue, which because I'm leaving, though it's not asked, I want to address, is the issue of permitting. Permitting for spaza shops in South Africa is not based on the nationality of the holder. It's based on if you're a foreign national, the owner must have been lawfully admitted into the Republic and holds a valid passport with a visa issued in terms of the Immigration Act of 2002, authorizing him or her to operate a business, e.g. a business visa, Section 11, subsection 6, visitor's visa with condition to operate business, a Lesotho special permit or a Zimbabwe special permit with a condition to operate a business. Or B, the owner must hold an asylum seeker permit issued in terms of the Refugees Act of 1998 with a condition to work. Or C, the owner must hold a refugee status issued in terms of the Refugees Act, is the asylum seeking status, the refugee status issued in terms of the Refugees Act of 1998. Those are the three requirements that you require. 4 requirements. If you are South African, you must have your valid ID. If you are not South African, you must meet the conditions that are set by the Home Affairs. Then there was a question of the closing hours of spaza shops. Spaza shops the closing hours is the same closing hours with those of the retail stores or any other grocery stores. There's no distinction. We have been pushing for a distinction, and we are working together with the DTIC to make a distinction to allow spaza shops to operate slightly longer hours, so to allow people to operate. We'll update when that agreement has been reached, and with all the other colleagues who are responsible for that section. Then there was a question about the Rupert's and Oppenheimer families' pledges. We must indicate they are not donations but pledges. Therefore, we are not in the position to respond on behalf of the Rupert's and Oppenheimer families' pledges. Thank you.
Thank you, Minister. It's just one question for the Minister of Small Business. The question is that many small businesses are faced with the possibility of collapsing if they can't keep... sorry, can I just start from scratch? Many small businesses are faced with the possibility of collapsing if they can't keep key staff working from home. Is there a possibility to get them to order and deliver urgently needed IT equipment in order to assist them to have mechanisms to work from home?
Thank you. Together with the Minister Stellanda Beni-Abrahams, we have agreed that small businesses and in the IT space or who want to order IT equipment, they must order the equipment online and get it delivered to their staff member directly, not through themselves. They must make those arrangements. Thank you.
I don't know whether, Babu Nxesi, whether you are part of the teleconference economic as well. If you are, come and answer your questions. Leave us this.
Thanks, Minister Mtembu. As your department considered the unemployed professionals for the UIF benefit, I must emphasize that, or the answer is no. UIF is for the employed and former employed. It's legal, it's there, it's very clear. That's why, for instance, when there are problems, if the company doesn't issue a certificate of service, we call for the pay slip, and so UIF considered all the retrenched workers in order to cushion them. That's what it's meant for. It's not meant for those who are not in the system. Those who are in the system will be the ones who are employed or who have recently lost their jobs. The numbers of the workers who have been frustrated calling us, is a huge number. I don't think we do have now a consolidated figure, but I can tell you that on Friday alone we had received 349, and on Monday we received 234. And these numbers, as people are becoming aware of our call center, are increasing. I don't know the number by today, I mean yesterday and tomorrow, but we are now consolidating those numbers, trying to do that on a daily basis from the different provinces. So we don't have a consolidated number. I must also indicate that only DTI can issue a certificate. No one else can issue a certificate, and the businesses must apply. There's a business portal of the DTIC. So DTIC is the only authority or authorized department to issue certificate of trading if the company is categorized as essential service. Further, the reasons given by the employers not to enter into agreement with Dell, they have not given reasons. We're just speculating thus far. But it seems as if they want to enjoy the easy option of just pushing everything to the workers. So they want to deal with what they have, because internally they have the payroll of the workers, they have everything of the workers. But it appears as if some are saying this it's an administrative burden. It's bureaucratic. Unfortunately, you can't deal with big monies, billions like that, there must be accountability. Some would want to dip in the UIF, but want to neglect the conditions which we are putting in place. It's not going to happen. If those companies do not claim, the workers will look into the option of allowing the workers to come directly to us. But it's going to be an administrative nightmare. But we think that workers should not be punished because of irresponsible employers. It's irresponsible for the employers not to take an option which is cushioning them and cushioning the workers. The applications, we have received 7,000 online claims from individuals, but we are trying to direct those individuals. We note and take all those details. We give them the forms which they have to fill in, but also interact with their companies, because we want now the claims to come through the companies. So these belong to different companies. We've also have 1,520 from the individual companies. So some of the companies are able to deal with the facility which has been given to them. And we expect that once we have finalized agreements with all the different sectors, the numbers are going to go up. Remember, in terms of the UIF, or registered, it's about 1.8 million companies. If that number of the companies, all of them, or let's say 50% of them apply, you know what it means. And the workers they represent, it's a huge number. That's why we have gone for this route of using the different sectors, the different industry associations, and now we are talking to the banks. We think that infrastructure will help us. But let me also emphasize this in Thulas. Once again, companies cannot force employees to take the annual leave. Companies must just learn to negotiate. Companies in this sensitive period must try and cooperate. It's a sensitive, frustrating period, we know that. But I think for the good of the country, let's all cooperate. But also, some of those workers who are stranded, it's an indictment on the trade union movement, because the unions are supposed to be our eyes and ears on the ground. If the leaders of the trade union movement cannot do what SACTU has done, because SACTU came forward, negotiated in their sector, and they have a collective agreement at the level of the bargaining chamber, and all the employers therefore are cooperating. We expect therefore that union leaders should come to the party and do not expect that everything will be done by government. They must help their workers in the different bargaining chambers. Thank you.
Thank you, Minister. The first question is from Tamar Khan from the Business Day. She's asking that since babysitters are not classified as essential workers, what then becomes of the children of essential workers such as healthcare providers? The next question was from Debo Khotwane from MoneyWeb. He's asking how many companies have fraudulently received certificates as essential workers. May the Minister please provide an indication of what sectors they are in and what services they provide. And the last question is from Jolene van Wyk from Media 24. She's asking whether there have been any transgressions from farmers, such as still transporting big loads of farm workers in trucks and not adhering to the social distancing regulations, and whether there have been any complaints from them not having received protective clothing.
The last one, any transactions from the farmers. Most of what we call the vulnerable workers, especially in the farms and in the security industry, they are serious complaints. And remember that those workers are vulnerable because they work in isolation. Who have received this. As a result, our inspectors in the different provinces are overstretched, running into some of the farms. And remember, some of them are very far in the outskirts, in the countryside. So those inspectors are overstretched because they also deal with a number of companies in the urban centers. So there are complaints from the farms. It's a matter again which we are looking into, but that is why we are saying we are going to depend on the well-being, on the will of the employers who must cooperate with us. We might try, but we can't be all over. If I'm talking about 1.8, almost 1.8 employers, whether we like it or not, even to go into 500,000 of those employers, it's impossible for us. That's why we call for everybody to be responsible. So we are trying where we are getting the information. As to how many companies with fraudulent certificate, this has been mainly rife in Gauteng and KZN. And I must not lie in the media. We knew of about 3 companies and about 4 in Gauteng, but that information might be coming to us because we've said to our inspectors they need to compile this data on a daily basis so that we have consolidated numbers. It's mainly retail and manufacturing. Mainly retail and manufacturing. Babysitters, we had not considered this matter. These are some of the issues which are arising we must look into. But in terms of the UIF fund, we don't know when we are talking about other funding and so on. Maybe it's something which we will have to put our heads together as the economic cluster and make recommendations. But at this stage, it belongs to a number of the other issues which had been raised.
Minister Pando, to reply to your questions directed to you. Thank you. You can even speak from them.
From here. Minister. Does it work? Okay. Is it all right from here? Thank you very much. Minister Mbalula answered a lot of the questions that I had marked as belonging to me, so I will try not to traverse the same ground. Let me begin by saying that we don't conceive that this repatriation now allowed by the directives is similar to the Wuhan process. We don't anticipate military health being part of it, a special South African Airways crew, or indeed the SANDF. What we're talking about is a rather different category. It's not after 51 days of lockdown in an epicenter of the pandemic and so on. We're talking of persons who have been, I think, affected by circumstance of the initial directive, where when the travel restriction was announced, they hadn't anticipated that it would be implemented almost immediately, had not made travel arrangements to return. Many of these individuals are persons who should have a ticket in their hand, apart from some of those in distress that I made reference to. So this is not in any way a Wuhan type of process. Should that arise, obviously we will make the necessary public statements in that regard. There are several of the 1,400 from high-risk countries, and you know those very well. I'm not going to refer to numbers now, but you would know that France was in the list that we'd mentioned, Italy, China, Japan, I think at the time when this was first announced. On the matter of ventilators, I'm not aware at this moment. We'd have to approach Minister Mkhize in that regard as to a shortage. I think we've had 3 deaths. I'm not sure how many critical patients there are. I know that preterm babies do require ventilators, so if we have a critical patient and there's a shortage, then there may be a concern. But I know that we are looking at manufacturing companies in South Africa, as other countries have done, to ask, for example, companies that manufacture electrical goods to look at assisting us by focusing on ventilators. And some of you would be aware that some countries are actually, through innovation, looking at reverse engineering and products that might not be necessarily associated with ventilation are now being considered for use for this purpose. So all of that would be part, I would assume, of the consideration that the health department would put into the mix. But it's not really something that we as international relations are working on at the moment. As to Africa at the back of the line, I didn't get that impression when we participated in the virtual meeting of the G20 leaders. I got a sense that there's an awareness that developing countries, and in particular the least developed countries, will have to be given assistance urgently, because you don't want the pandemic to increase. Because what is very clear, as we've been arguing for a long time with respect to Ebola, you might recall, is diseases are global. People may think they are local or national, but they are global in effect, global in impact. And if we don't assist each other, and that's been, I think, statement number 1 from the Director General of the World Health Organization, if we do not collaborate, this problem becomes bigger for all of us. And so I don't think we should marginalize by any means Africa, because we should ensure that we really curb the spread and that we pause this disease. I think even in terms of science and the emerging collaboration we're seeing among scientists, we want this to be a global initiative. We're very pleased that several of the G20 countries have already made commitments to assist the CDC in Addis Ababa, the African Center for Disease Control. We have made our own commitment as South Africa toward that initiative, because we have to empower ourselves to be part of international research and innovation initiatives. So I would really argue against a notion of Africa being at the back. We'll be doing so to the detriment of humanity. On offers of help, we have had offers already from Germany. There's a significant commitment already, as well as from China, where it's not just the government of the People's Republic, it is also companies that operate or have operations in South Africa and other parts of the continent. But we are marshalling our own Africa Emergency Fund, as announced by the Bureau of the African Union, which is chaired by President Ramaphosa. And we, as Bureau members, have made commitments, and we anticipate all the African countries will place some resources into that pool so that it grows into a bigger pool that allows Africa, through the African Union, to provide assistance to countries that may need help on the continent. Mr. Cho of NHK, I really wish to apologize for what you say you've experienced in our country. It is embarrassing and it is most regrettable. We have to unlearn this behavior of stereotyping and doing so in a manner that reflects xenophobic attitudes. I think we should not be using the kind of labeling that you referred to, and we need to have public education on this. We've begun to talk much more about stigmatizing around COVID-19 because we're seeing some of that happen. I experienced it myself because Mail and Guardian Online had a false story that I had COVID-19, and I noticed my officials jumping every time they saw me. So I think we've got to teach each other about stopping the stigmatization when we face a problem, a disease of any kind. What we should do is all support each other in terms of the protections that are announced by the state to ensure that all of us exercise due care, that we follow the measures of hygiene that have been announced, and that wherever we are, we observe the strictures that government has spoken to. And this is the public education and public message we should put out there. We will only resolve the challenge of COVID-19 by cooperating and collaborating with each other. And I hope that South Africa, which is a country that upholds non-racialism, non-sexism, and equality, will be a country that reflects the best values in the world, and we won't have a repetition of the experience, Mr. Shao, that you said you had. With respect to the passengers in quarantine in Rome, Minister Mbalula spoke to that, but let me just add by saying, really, when you are safe and being cared for, it is better to remain in a safe condition. Because movement, and we're trying to reduce movement, movement adds to the potential for infection of yourself or for you if you are affected, you infecting others. So when you are in quarantine, please respect the rules that are in place, because your safety assures the safety of others. Thank you very much, Minister Mtembu.
Thank you, Minister. You really have represented all of us as you were answering the question by the colleague from Japan. Colleagues, I know that there is a few questions. We have a question online. Yes.
Minister Mtembu, we've got Vuyomboka again from ENCA.
Vuyomboka, are you the only person who used this platform?
Well, a quick one from me, just a follow-up to the question I asked the Minister, which she responded to. The nature of the offers from China and Germany, is it for equipment, money, expertise, medicine? What exactly are we talking about?
Largely it is equipment that we are receiving offers for. It is equipment, I hope you can hear me. And it is mainly personal protective equipment, as well as face masks, and then some other goods that are required with respect to protecting both individuals as well as health workers insofar as management of the pandemic is concerned.
Thank you, Minister. Do you have any questions there, Sisi?
Yes, Minister. There is one from Sophie Mokoena of the SABC. She's asking whether South Africa is participating in any international vaccine trials and whether the panel can share information on what government is doing to help South African citizens, or that has been answered, who are abroad and want to come home. The other question is from, I can't pronounce the name, it's from an independent journalist from Brazil who's asking that, or is stating that there are currently apparently 500 Brazilian tourists here in South Africa waiting for an opportunity to fly back home. When will LATAM be able to operate the next flight from Johannesburg to Sao Paulo? There is only one flight scheduled for tomorrow, but they are still waiting for the authorization from South African government.
Who takes it?
I'm sure with respect to authorization, Minister Mbalula's office will be dealing with that. He has been excellent in terms of prioritizing when we approach his office. And so I'm sure we would be able to make sure that our comrades from Brazil get home safely. With respect to the vaccines trial, again, I prefer that this question be put to Minister Mkhize as the Minister of Health. There are trials in which South Africans are participating. I believe these are novel drugs, or there may be drugs currently in use, or that have been authorized in other countries as suitable for addressing COVID-19 or aspects of the symptoms of this disease. But it is the Department of Health that will be able to provide the full information. And as in science and technology, I could pronounce all those names, I no longer can. I saw them in a list recently, so I think Minister Mkhize must speak to them. But there is some work being done. Thank you.
Minister Mbalula? Oh, covered. There was one question. Let's hear the question from the call center.
We've got one more question from Peter at the Daily Mirror.
Peter, you can speak.
Hello? Peter, you can send your question. Please close your radio or TV.
This is Peter Fabricius from Daily Maverick. Two questions, if I may. One is to Minister Mbalula, to ask that many of the embassies that are arranging these evacuation flights are very concerned about the conditions under which their citizens will have to get to the airport. That they're finding these rather onerous because they've been asked to gather people together and take them by bus, and that could, of course, spread the virus. And then just a question to Minister Pandor. I think you were asked this, but just to be specific, you said South Africa is prepared to help evacuate some of the nationals, our compatriots in distress. Do you mean by evacuation flights for them, or what other measures? I mean, in other words, what is the program for evacuation flights specifically? Thank you.
Thank you. Before we answer these questions, let's take the last round now here so that we can also go home. Take that gentleman there, up there, and the gentleman. So there are only two hands. Thank you very much for your all. Okay, there is a third hand. No problem. We have got three questions. Let's take it.
Thank you so much. Francis Luamachata from Progressive Independent News Agency again. My question goes to, actually it's a clarity from Minister Mbalula. Very well now. You said that taxis will only ferry essential workers, not the public. And this, I find it to be in contradiction with your answer when I asked this question about those citizens staying in remote areas and might be wanting to go buy essentials far away from where they're staying, when you answered that they will be accommodated in these minibus taxis. Can you please clear that?
The next colleague.
It's again Nazir Nur Mohammed from Globe TV. I just want to know if government took a decision or reconsidered the sale of cigarettes to the public.
You want cigarettes? Okay. Next.
Thank you. It's CD again from News 24. Just two very quick ones. Minister Mbalula, I think we spoke over the weekend about the issue around the UK. People were stranded here, the citizens were stranded here, and there was an issue around whether or not the crews can disembark. And I see that SAA is assisting Germany. Has a deal been reached? Has a solution been reached for the UK citizens? How are they going back home? Because they were stuck over the issue of whether the crew can disembark or not. And then quickly, Minister Naledi Pandor, you know, there's a lot of talk about how Africa is working together with regards to tracking and tracing cases in South Africa. Obviously, some people over the weeks have moved either in and out of the continent as well. Are there conversations, are there plans in assisting each other in terms of tracking whether or not people who might have been infected in Joburg are now maybe in Eswatini, along those lines? What are the conversations and plans around that? Thank you.
Those are the last questions, colleagues, and thank you very much. I now hand over to my colleagues.
I think with respect to the matter of evacuation, it might be flights. I just want to go back to the point I made earlier. There was an unintended consequence when the initial regulations on air transport were published. Persons who had been booked or were about to travel, all airlines stopped their flights from taking off. So there are persons overseas who have tickets, who can or should be accommodated on a commercial airline, which will now have to seek permission and through a passenger manifest assure us that the persons who are on board are South Africans returning from that specific country. That is the process that we are referring to. So the evacuation, if any, will be of persons who are entirely stranded, who do not have the means. For example, a student who had perhaps gone for a short-term course or a one-year course or part-time work and now finds themselves without means. The company that had hired them has closed down. They're totally without any form of support. That kind of person, should there be an international flight or indeed a South African Airways one that is able to bring them back home, we should provide support for them to return home. If they are in need of accommodation, as some indicate they are, within our limited means, we will try to assist in very difficult circumstances. But we're not saying that the government has the means to assume all responsibility. We don't. And we are talking of persons, many of whom are tourists, who do have bookings. We're saying travel agents, please allow them to rebook a return once the flights announce, the airlines rather, announce that they're now ready to apply to South Africa in the manner Minister Mbalula has set out, so that those arrangements can be confirmed and people can indeed return home. On the UK citizens, we have sent out a note verbal to all the missions located in South Africa. As I said, we're going to publish a set of standard operating procedures. One of the ways, in order to assure that we don't create an untenable situation, one of the requirements is the embassy should indicate, we want your assistance in repatriating our nationals from South Africa. Otherwise, we may very well have a situation where there are persons moving from area to area in South Africa who came into the country with an infection or who become infected as they move around. And this is why we want a modicum of control of the process, with the leadership of the missions playing a role of facilitation. Because if you just leave it loose, it will be intolerable for our country. With respect to the continent, we have agreed that the core repository is the Center for Disease Control, located in Addis Ababa, and that it must liaise with all centers for disease control in different parts of the continent. There are countries that don't have such centers. In the SADC region, those that don't would often make use of NICD in South Africa. So we are encouraging certainly depositing of the data with the Addis CDC, the African one, as well as collation on a regular basis of the picture as we see it on the African continent. I do know that the World Health Organization is speaking to each of the leaders of the continent in order to ensure that we are working not just continentally but globally as well.
Minister Mbalula.
1, 2. 1, 2. Yes. On the issue of citizens, let me just, explain again that the lockdown does not encourage movement of people between provinces and also within a province or within a city or a township where you stay. We only allow limited, transport for purposes of essential workers. Now, I've heard people raising the issue that we should allow people and what will happen to people after they've been dropped by taxi or transport early in the morning, because shops are opening, at 9 o'clock, and we're allowing transport between between 5 o'clock and 9 o'clock. And we're saying that transport is limited because we cater for essential. But if you go and you want to go and buy and all of that, we have adjusted our directives at the present moment, which we'll announce tomorrow after we have concluded with the taxi industry and we have gazetted at the present moment. But transport is not for movement of people. Yes, where people want to buy, they can do that if they are at a distance and so on. We are encouraging people to buy in their neighborhood, not to travel between Alexander and Soweto. That will happen after the lockdown. We seek to contain the virus, and that is what is happening here. If you are in Alexander, buy in Alexander. If you are in Soweto, buy in Soweto. If you are in Zingi, buy in Zingi.
Where is Zingi?
If you are in Butshabelo, buy in Butshabelo, And that is what, because in every section in Butshabelo or in Mamelodi, there is a shop there is a spaza shop where you can buy food and so on. We don't encourage, and it's not going to be possible where you can travel, you want to buy clothes and so on. In this period, that is not possible. The only thing you can access is food, and food supply is galore. And that is why you've got many transport caravans that are operational in this period to assist and to be in a position to provide food in the areas where people stay. So we don't encourage movement of people, and unnecessary movement is the lockdown. So you stay where you are and then you don't commute. Where commuting is allowed in the morning, you can go. We will announce new directives tomorrow in terms of public transport and how we are going to cater for citizens. With regard to UK citizens and how are they going to travel and so on, that will be catered for in terms of the new regulations and the directives to enable UK citizens to travel to back home, but not allowing UK citizens coming into South Africa. So that is prohibited. Now, governments have been approaching South Africa through DERCO, and DERCO through the protocols, which will confuse you. Note verbals or indon land. And then I must explain to you what is NOTAM. Now, NOTAM is a notice that we give to all allies to say that from this date, don't come to us. And the note verbal is what Minister of DERCO will have to deal with in terms of protocols for the citizens of that country in South Africa. There are also protocols that are followed here in the Republic. What you must understand is that we are ready to evacuate. That is in terms of the new directives. We are ready to evacuate citizens from wherever in the country and to go back to their own countries. The same as ourselves. We will be assisted to get our citizens who are stranded in other countries to come back home. So that is what we are ready to do now. We have issued new directives, but that does not allow free movement again of airlines over and again coming in and out of South Africa. It's only for that purpose that you've got your citizens here, and therefore we will be ready to release them to come back to South Africa. So those are the things that we are processing that will be done by our operatives on the ground, and they will actually be implemented. So UK citizens in South Africa, we are happy to get them and assist them to go back to UK. And that is what we'll be doing going forward, and with all other citizens from all other countries who have made requests to South Africa that please, we are ready to evacuate our citizens back to our different countries. Thank you, Minister.
Colleagues, speaking of directives, let's just give one last directive. All our press briefings from now onwards will be, what is the terminology? Virtual. So we'll be communicating with you where you are. You will not have to come here for very obvious reasons, so that we remain here, we don't get sick, we don't infect you, you don't infect us. And we will continue to have these briefings in this virtual manner. We will have some on Thursday, where our colleagues from the economic cluster will speak to you. And of course, you will be appraised of when are we going to have others. But we will continue updating you, because through you, we are able to speak to our people. We appreciate your partnership, because in this, we need to work together to fight this disease. We need to be in unison in our efforts and in our response against this deadly disease. And what we have seen up to now is that we are together with the media. We are together with many people in our country, many millions of South African citizens, but even people who are in leadership positions in our churches, in our traditional leadership, in our sports and arts fraternity, indeed in our traditional leadership. We have many of our people who are saying we must work together to fight this disease, because if we don't, I shudder to think what will happen. We therefore need to work together. So far, we are doing well working together. Let's once again ask our people to stay at home, ask our people to observe physical distancing. It was called social distancing. There's a new terminology now, physical distancing. Let's be 1 meter from one another. But let's continue again to wash our hands so that we don't infect ourselves through the virus that we can pick up from any object. We therefore, with these words, declare this meeting adjourned until next time we meet through the visual means. Thank you very much.
it's in Limpopo.
Where is this place of
It's in
yours?
Limpopo. Yeah, it's in Limpopo.
All right, so we're going to leave that briefing. If you've just joined us, tuned in a short while ago, you will have been watching yet another ministerial briefing from yet another cluster, speaking to some of the initiatives and the latest interpretations of some of the actions that have been declared with regard to the fight against COVID-19. And of course, Minister in the Presidency, Jackson Mtembiasi, has been doing all along, coordinating those ministerial briefings with the media. And he was saying that we need to work together. We're all in this together to fight this deadly disease. And interestingly, that this would have been the last briefing where media is actually physically present at the GCIS building in Pretoria. From now on, all of those meetings will be virtual, where the reporters will be at their various areas of work and dialing in either electronically or on the phone, as you've heard. All right, so there were a few ministers that were present, and they all shared their various points. And in the main, it was really talking about, in their areas of work, how this COVID-19 lockdown has changed the game slightly, and some of the initiatives that are going to be playing out. So, for example, the Minister of Labour and Employment, Thulas Nxesi, spoke about the arrangements regarding the UIF employer-employee relief funds that are going to be released, and how that is going to be dispersed. The number of applications already been received in that regard because of this lockdown. The Minister of Small Business was asked a number of questions about small businesses, spaza shops in particular, things like would they be able to access support funding, and she says that these small businesses have to be properly registered and have permits to work, which they can still get, and then they'll be able to be assisted. The Minister of International Relations and Cooperation, Naledi Pandor, also spoke about the cooperation that's taking place at the moment between South Africa and other nations. Our citizens are abroad, and we have their citizens here, and trying to find a way to work together to make sure if we can get citizens to their countries, we'll do so, and try and get our citizens back home. But also that if citizens are staying in other countries, she's grateful for the assistance so far that these countries are giving in terms of perhaps extending visas, forwarding consular services and that kind of thing. And she was asked about things like ventilators and whether Africa was actually at the back of the line in terms of the distribution. And she says no, she believes that the countries, the developed nations, are more than willing to assist the continent. And importantly, she spoke about stigmatization as well. The Transport Minister, Fikile Mbalula, was asked about these two ships, and we'll go into that a little bit later on, the Queen Mary and Queen Elizabeth, that have docked at Durban Port, and we'll tell you a little bit more about that. But they've all been tested, and there's a few protocols that are going to be taking place, particularly with the 6 South Africans that were on board. And so again, there's no flights in and out except for essential flights, cargo as well. A lot of protocols still to play out now in terms of sanitization of cargo, etc. And then the transport issue in terms of taxis, whether they the times they're allowed to operate, and the circumstances. People concerned that they want to go shopping, but these taxis are not operating. He says that he's engaging with the taxi industry, and the decisions that have been made will be properly communicated tomorrow after everybody has had their say. But they've heard the cries and the pleas, but by and large the issue is that people must stay at home and they shouldn't be moving around, and it's certainly not possible to move from province to province as some people have been trying to do. So these restrictions are in place. So that was the ministers. They say the next one will be around Thursday with the economic cluster, or unless otherwise stated, but we're expecting to hear from the transport ministers certainly about the taxi industry and public transport sometime tomorrow. All right, we're going to leave that for the time being. We're going to take a quick break, and when we come back, we're hoping to go to Durban because the Minister of Health is there, and of course those two ships being a big issue there, and Ayanda Mhlongo is there standing by for us. So we'll be going to Durban in a short while. That's where we'll leave it. By the way, if you've just joined us, I'm Peter Ndoro. Vanessa is away today, and you're watching SA Today.